Do you think a herniated disc means that you're going to be in constant pain for the rest of your life? Well, I'm here to tell you that's not true. Herniated discs are very common, but with the right understanding, treatment, and recovery plan, you can regain control of your life. In this video, I'll walk you through the truth about herniated discs, what the symptoms really mean, the treatments that work, and how to recover faster. Hi, I'm Dr. Deeptee Jain, a spine surgeon. If you or someone you know has been diagnosed with a herniated disc, this video will help clear up a lot of confusion. I'm going to explain what a herniated disc really is, the symptoms you should watch for, the best treatment options, and most importantly, how to get back to your normal activities. Be sure to hit subscribe so you don't miss out on any of my future videos on spine health. When it comes to herniated discs, there's a lot of misinformation out there. Some people think that they're a life sentence of chronic pain, while others believe that surgery is the only option. But that's not true. In fact, most people with a herniated disc don't ever have surgery and can recover with the right treatment. So let's clarify what a herniated disc actually is, how to spot the symptoms, and what your best options are for treatment and recovery. So first, let's talk about what a herniated disc is. Here I have a model of the spine. Your spine is made up of vertebrae, bones that stack on top of each other. These here are the different vertebrae in the lumbar spine specifically. Sometimes in this disc, which is the cushion that goes in between the vertebra, the disc, the jelly-like substance inside the disc can actually herniate and squirt out, and it can press on the nerves that are coming through the spinal canal. This can sound scary, but it's actually really a common issue, and the good news is that most people recover without surgery. The symptoms of a herniated disc can vary, but here are the most common ones. First of all, pain. You may feel a sharp or burning pain in your low back, neck, or even down an arm or a leg. If it goes down the buttock and the leg, this is what is colloquially called sciatica. The medical term is radiculopathy. Numbness and tingling. You might notice a tingling sensation or numbness in your leg, foot, or arm, depending on where the herniated disc is. Weakness. Sometimes a herniated disc can cause weakness in the affected muscles, making it harder to move or lift things. If you experience these symptoms, it is important to get evaluated by a healthcare professional for proper diagnosis and treatment. So what can you do about a herniated disc if that is what you have? Here are some effective treatment strategies that don't include surgery. First of all, physical therapy. Working with a physical therapist can help strengthen the muscles around your spine, reducing pressure on the disc and improving your pain and function. Medications. Over-the-counter pain relievers like ibuprofen or prescription medications can help manage the pain and inflammation associated with a herniated disc. We can prescribe medications like nerve pain medications, muscle relaxers, strong anti-inflammatories, and even steroids. Heat and ice packs. I will say patients often ask me what's better, heat or ice, and I usually tell them whatever feels better for you. Injections. There are a few different kinds of injections you can try. The most targeted type of injection for a herniated disc is called an epidural steroid injection, in which your doctor, usually a pain management doctor or a physiatrist, bathes the nerve roots in steroid, calming the inflammation and thereby hopefully improving the pain associated with the herniated disc. These treatment options, importantly, are often based on personal preference. Some patients tell me they don't like taking medications. Other patients say they don't come near me with a needle. There's no right, there's no wrong. So have you tried any of these treatments? Let me know in the comments what's worked best for you, or if you're interested in learning more about physical therapy exercises. So when do we consider surgery? Well, most people with a herniated disc recover with non-surgical treatments. But if you have a herniated disc, you may choose to proceed with surgery. The most common reason I perform surgery on a herniated disc is persistent severe pain. If the pain is so intense that it doesn't improve with any other treatment, sometimes we will indeed consider a surgery. We usually recommend that you've tried at least 6 weeks of non-operative care before considering surgery. And that's usually the benchmark time frame that's been studied in a lot of the evidence that we have around herniated discs. Second, loss of function. If you experience weakness or loss of bowel or bladder control, the loss of bowel and bladder control can constitute what's called cauda equina syndrome, which is a medical emergency. And in those situations, we will often recommend a rapid, quickly performed surgery. But remember, generally, surgery is considered a last resort, and your doctor will guide you through your options if needed. Recovery from a herniated disc depends on the severity of the pain and the treatment options chosen. If you opt for non-operative care like physical therapy, medications, and injections, many patients see improvement within a few weeks to months. But full recovery can take several months, so it's important to be patient and stick to a treatment plan. Regular follow-ups with your doctor and physical therapist will ensure that you're on the right track. So if you've had a herniated disc, share with us. How long did it take you to recover from it? Share your experience in the comments, and I'd love to hear how you managed your recovery. So to recap, here's the truth about herniated discs. They're common but treatable. With the right treatment, most people can recover without surgery. First, watch for symptoms like pain, numbness, and weakness. Second, consider physical therapy, medications, and injections as treatment options. And finally, surgery may be a last resort for persistent symptoms. Remember, every recovery journey is different and patience is key. If you found this video helpful, hit that like button, subscribe for more tips, and share it with anyone who might need it.